in Minnesota and treating those as part of our hospital planning and treating those as part of our rapid response plan, because those individuals may live in East Grand Forks, but they're going to be likely receiving care from a North Dakota provider. The final 52 tests that are not yet run through the lab will be completed by this evening, and then we've also been following up, of course, with a extensive contact tracing, and we'll know exactly how many team members, how many household residents and others that they may have had close contact. The individual case investigations will continue and be ongoing, but in conversation with Debbie Swanson today from the Grand Forks Public Health Department, we've got over 20 people deployed working specifically just on LM contact tracing, and we'll bring more resources to bear as needed. One thing I want to add with this plant closure, GE has been a great corporate citizen in that as they're asking their employees to stay home during this time period, but in addition to that, they are paying their employees during this 2 weeks that the plant is closed. They're also doing thorough plant cleaning that's already been started. They're doing that while the plant is closing. But there's a key piece of news here, which is that given that quarantine and isolation are critically important at this juncture to prevent further spread, therefore, as authorized by North Dakota law, State Health Officer Mylyn Tufte today is issuing a quarantine order for all LM Wind Power employees. And then we say all, this would be all those that worked in the plant, whether they've tested positive, tested negative, or not been tested. And again, we want to, for the public, want to help people understand, particularly since there's been a lot of talk in our state and nationally about reopening. We've also said that we could be open, it could be next August, it could be next November, and you could have an outbreak like this. And if we have an outbreak and we want to stay open, then we have to do the targeted approach. And the targeted approach is that we come in and we make sure that we identify those positives, those who have had close contacts with positives, those household members with positives, and then those people either self-isolate voluntarily, or in this case, are covered under a quarantine order. We know that that in a city the size of Grand Forks, if you've got this many positives and this many potential team members, that we could have rapid spread. And again, we had to put that out today. It cannot be delayed because it would jeopardize the local ability to control the community transmission of this contagious disease. And again, we've talked before about direct contact and community tracing. If you've got an outbreak like this in a plant where people are working closely together, then we can identify where they got it and how they got it. If those folks can stay out of the community, then we have an opportunity for us to slow down the spread and make sure that we can keep people safe, particularly those that we're focused on every day, which is protecting the elderly and those that have underlying health conditions, particularly those that are in congregate living situations, of which there are many nursing homes and assisted living in Grand Forks County. And so part of this stay home, of course, is to protect those individuals. Individuals must remain in their homes or places of residence during the period of quarantine. They've got to cooperate with local and state health officials. They must participate in the contact tracing efforts, and they must remain at home unless otherwise authorized by Department of Health, and instructed to please contact the Department of Health or their providers if any COVID-19 symptoms occur, fever, cough, etc. By responding swiftly to these localized outbreaks and using targeted testing, we can quickly identify individuals and begin the contact tracing process to prevent further disease from spreading. This process worked as designed in Grand Forks. It also worked last week in Montreal County when we went into Montreal County after a initial outbreak there, and were able to demonstrate our response capabilities, our testing capability, and our contact tracing to slow the spread and save lives as well as livelihoods. As the number of North Dakota positive 19 cases in North Dakota have risen sharply the last few days, we urge all North Dakotans to continue to practice physical distancing, avoid gatherings of 10 or more, avoid hosting them or attending them, implement proper safeguards in your workplaces, and follow other CDC guidelines. And regarding proper safeguards in the workplaces, again, there was a number of things that were done by LM Wind Power in advance of this. But again, this is probably a good recognition for all employers who've got people who work in situations where they maybe have difficulty maintaining the full physical distance of 6 feet or more throughout the workday. Again, inviting and asking all employers, because again, the majority of our state is still open. All of energy, all of ag, all of healthcare, education, well, to distance learning is still operating, and any other businesses that were part of that work that they do, including government work and city work, whether it's police departments, fire departments, garbage, all the services that are going, the large swath of our economy that's still going. We ask anyone who's managing teams that work in large areas like this to make sure that you're reviewing your safeguards in those workplaces. The good news is we've only had one hospitalization so far among LM Wind Power employees who've tested positive, because again, the average number of days between onset of symptoms and hospitalization in North Dakota has been 6 days. The maximum time from onset to hospitalization has been 13 days. And so, well, we have a lot of hospital capacity left, as we've talked about. Usually that's been arriving, sort of 1 week to 2 weeks after the onset of symptoms. We hope that no one that tested positive is going to need hospitalization, but this is the reason why the 14-day period, because we've got to cover sort of the whole arc of this disease. We do have, we're going to hear shortly from Mayor Brown and Dr. Weiser to talk about how they've got adequate capacity and how they're handling things well there in Grand Forks. But it should also be noted that for those that maybe haven't made the connection, but LM Wind Power Plant is considered a critical manufacturing business by the U.S. Department of Homeland Security and was not subject to any of the business closures we've ordered during the COVID-19 emergency. And if it had been in any other state in the nation that had shelter at home or stay at home orders, it also would have been excluded from those because of its designation as a critical manufacturing business under the Department of Homeland Security guidelines. Next up, by phone, we'd like to invite Mayor Brown to make a few remarks. And as he comes online, I want to thank Mayor Brown. He's been a great collaborator with the state of North Dakota even before the pandemic, but we've had great communications and great teamwork from Grand Forks. All the work that they were doing up there prior with the Main Street Initiative, we deeply appreciate, and he and his team have done a great job here. And of course, it doesn't hurt that he's also a medical doctor and has personally delivered a large portion of the people that now vote for him, so as an OBGYN. So anyway, Mayor Brown, great to have you on the phone. Take it away.
Thank you, Governor Burgum. We were hoping to avoid something like this, but we planned for it and prepared for it. We've identified and are isolating the problem and are doing everything we can to mitigate the spread of COVID-19 so we don't overwhelm our healthcare system. My sincere gratitude goes to you, Governor Burgum, for the forward thinking and the piloting of these mass testing events like the one conducted in Slope County. The state and the rapid response team worked well with local officials and the event well as designed. This mass testing done locally at LM Wind Power allowed Grand Forks to look for positive cases instead of waiting for them. LM Wind Power and their employees have been a proud part of the Grand Forks story for over 20 years, and we thank them for their partnership in this response. We're working collaboratively with All True Health System, the state of North Dakota, for LM Wind Power to identify, mitigate, and contain the spread, and we expect more positive cases to be identified in the following days. We anticipate this to be a prolonged battle. As said before, this will be a marathon, not a sprint. These efforts are all part of a partnership and a common mission: mitigate the spread of COVID-19 in Grand Forks and the state of North Dakota. The partnership between our public and private sector entities includes the city, state health department, North Dakota National Guard, our healthcare system, and ultimately the citizens of Grand Forks. I have faith and confidence that what we have in place can and will work. The citizens of Grand Forks are an essential part of this partnership. We need to stay home, only go out for essential trips, practice physical distancing, sanitize frequently used surfaces, and practice good hygiene. Stay home for our nurses and doctors. Stay home for our public health professionals. Stay home for our police officers and firefighters. Stay home for our elderly population. Stay home for those with pre-existing conditions. I call on the good nature and moral fortitude of the citizens of Grand Forks to follow the CDC state and city guidelines. They are no longer recommendations and guidelines to follow, but mitigation efforts that are expected to be taken. We expect you to stay home except for only essential trips. We expect you to wear face covering in public. We expect you to stay 6 feet away from others when possible. We expect you to frequently sanitize surfaces. And we expect you to take responsibility for the health of Grand Forks. We all love this community, and your community needs you to be North Dakota smart. Thank you, Governor Burgum.
Thank you, Mayor Brown. And next up, we've got Dr. Stephen Weiser from Altru. And again, Altru has been one of the providers in our state that's been a great collaborator through this entire effort. And they've been a key part of the Grand Forks community for a long time. Dr. Weiser?
Good afternoon, Governor Brown, and thank you, Mayor. Sorry. Good afternoon, Governor Burgum, and thank you, Mayor Brown, for the kind words. Altru Health System has been working as the community health system for Grand Forks and the surrounding region. We've been working closely with our partners in public health, as well as the mayor and the North Dakota Department of Health, ensuring that appropriate testing and care for COVID-19 patients over the past 5 weeks now. Prior to this week, Altru had completed the majority of testing in our communities. Until recently, we were managing a relatively low number of cases, but that changed this week. As our governor shared, the state and local public health department led a mass testing event related to this cluster on Thursday. We thank the state for their strong, swift response in holding this event. The results of this event have greatly increased the total cases in Grand Forks in a very short period of time. While Altru has a very strong plan in place to accommodate a surge in our hospital, it is more imperative than ever for the citizens of our community to adhere to the expectations put forth by our public health officials, our health system, our city leader, and our governor. Now is the time to slow and contain the spread of this virus. Altru will continue to offer testing for those who meet state guidelines. Our screening hotline remains open 24/7. Our sick clinic is open extended hours and on the weekend to care for those with respiratory symptoms. Our first responders and emergency room have strict protocols in place to care for those with severe symptoms. We currently have a dedicated inpatient unit for those with COVID-19 or those who are awaiting test confirmation. Our surge plan includes a tiered approach that can accommodate up to 292 beds and 33 ICU beds. We currently have 88 ventilators in stock. Given the models we have available today, Altru will confidently care for the current positive cases in our area. The important step now is stopping the spread of continuing, practicing isolation and quarantine procedures when directed, and physical distancing for all. Altru's priority has and has always been the safety of our patients, staff, and our community. Our staff are on the front line, and they will stay there for you. We thank our partners at the state and public health for their swift response to this situation at hand and their continued collaboration in the weeks ahead. Thank you, Governor Burgum, for this time today.
Thank you, Dr. Weiser, and again, thanks for you and your team and all you're doing. And I know that the locals in Grand Forks can find that hotline number, I'm sure, on the Altru website as well, and we'll maybe make sure that we get that information out as well. But thank you for that. Next topic relates to homelessness, as we know that homelessness is a situation for some people in our state. And while we wish it wasn't so, it is. There's a lot of misconceptions about homelessness, where people may think that this is a permanent population. The reality is people move in and out of this state, and it can happen to young mothers. It can happen to unaccompanied adults. It can happen to anybody of any age. And when it does, it's usually with that condition of homelessness, there's also the co-occurrence of physical health issues and mental or behavioral health issues. And so this population, we know that having health in your life starts with having a safe, healthy home. Many of these folks that are currently in homelessness have been in shelter situations at times. We had a description here by Chris Jones a few days ago talking about some of the efforts, but we do know that outbreaks can happen anytime you've got congregate living situations. And we've been paying particularly close attention to these populations that might be at risk due to age, underlying conditions, or circumstances. And it's being at a greater risk does not mean that an individual is a greater threat of spread. It just means that we must support them with the right kind of supports. Yesterday, DHS from North Dakota announced a new temporary shelter program to serve vulnerable individuals who are homeless and cannot stay at existing homeless or domestic violence shelters because they've tested positive for COVID-19. And when you test positive for COVID-19, you fall under the quarantine orders that we previously issued. So this new program, serving those with truly nowhere else to go, is serving 12 people across communities in North Dakota. And if needs grow, the program can be expanded to serve homeless individuals who need to self-isolate, and we're offering this opportunity in Bismarck, Devils Lake, Dickinson, Fargo, Grand Forks, Jamestown, Minot, and Williston. Local Human Service Zone offices will work directly with any individuals or families that are referred to the program by a homeless shelter, a domestic violence shelter, a hospital, a public health unit, or other partner agencies. It's important that people must be referred. Shelter location information, you can find those locally, and any one of those can then refer you to local human service office. Regional Human Service Centers will provide homeless case management services to participants in temporary shelter programs, and will also make sure that they've got access to nursing support and meals. This temporary shelter program supports our ability to serve vulnerable North Dakotans who are unable to quarantine in a home of their own and prevent outbreaks from occurring within vulnerable populations that are served by our homeless or domestic violence shelters. We all have a responsibility, individual in responsibility, to be North Dakota smart, and as a state, we are also working to protect our most vulnerable citizens from potential outbreaks and provide services to keep them safe. Thank you for joining us today. We appreciate very much your being here. Got a couple of quick announcements before we go to questions, and first one is on the pandemic unemployment back payments, which we know this is something we're working. I referenced this with our aging mainframe computer. There's been great work that's going on by the team over there that's kept it going for these past decades, as well as NDIT and our vendor partners that are helping us. There was about, because of the high volume, and we've got to pay by back weeks, there was about 60,000 back weeks. So take number of people times number of weeks, and that's how you get 60,000 back weeks. Many of the individuals, had more than 1 week of these FPUC payments on the list. We were able to come up with a workaround, but the workaround wasn't allow us to do a run where we could do all 60,000 at one time. So we split it into 3 runs over 3 days. So 20,848 weeks worth of checks were completed through Friday night. That amounted to $12,676,389. Though that amount should be in claimants' accounts on Monday. We've got 2 more runs of this 20,000 plus that will likely be similar dollar amounts, and we'll be running those, attempting to get them run over this weekend if we can keep the system up and running. But again, I want to thank the team over there for their creativity and diligence and round-the-clock work to deal with this unprecedented load of work. Of course, North Dakota Smart, which we've talked about, and you see up on the slide here, again, all of these same principles stay in place that we've talked about over and over. Stay home, stay healthy, stay connected. You heard Mayor Brown talk about this, but when we have outbreaks like this, we want to target them with testing like we did, which is going to drive our percent of positives up. We want to get in quickly with the quarantine for those people who may have been exposed, and that allows us to stay on a path for the North Dakota Smart restart. But again, the North Dakota Smart restart is going to be driven by data and numbers, not by the calendar. 2 of the criteria in the federal program for reopening include a drop in your case count and a drop in your 14-day average. And in the case of North Dakota right now, we're going up in both of those cases versus going down. So the North Dakota Smart guidelines, more important than ever. If you're someone that's interested in making sure we have a North Dakota Smart restart as soon as possible, then all the more important that to follow these rules right now, because we know there are more active cases in North Dakota now than there ever has been. And so therefore the potential positive contact with an active case or someone else who's had contact with a contact is greater than ever. And so these rules more important than ever. And then lastly, on a note of gratitude, before we go to Q&A, I want to say, bring another quote today, a quick one, but the quote is that nothing is more beautiful or powerful than an individual acting out of his or her conscience. Because by doing so, they thus help bring the collective conscious to life. And again, we've talked a lot about individual responsibility, but it is a beautiful thing when people are exercising their individual responsibility, and as part of that individual responsibility to themselves, to their family, and to society, they can help keep North Dakotans safe, particularly those who are most vulnerable, that we're working every day to try to protect them from this deadly disease. With that, we'll stand for questions. And again, thanks everybody for being here today. Radio legend Dave Thompson, quick, out of the box, first hand up today.
Fairly, maybe a little bit more esoteric, but Governor, do you know about the number of people who were tested? How many were from Minnesota and how many Minnesotans were positive?
I asked that question at a conference call about 2 hours ago, and they're trying to dig up that answer. We do know what I did share today, that 8 of the known today of the 110 are known to be Minnesota residents. So the vast majority right now appear to be North Dakotan residents. We'll go online and then come back over here.
Matt Henson with WDAY. Do we know how many of the positive cases were asymptomatic?
That's part of the investigation, Matt, that's still going on. We did not have that at press time today. But they'll continue to do the case tracking on all of the remaining ones. We'll get some more testing results in tonight, and then we'll have more information on Monday on that. Jeremy and then Jacob.
This might be a question for Mylin as well. I'm wondering if the quarantine order for LM workers also applies to people who live with them, whether they're family or just a roommate, something like that.
Could you hear the question, Mylin? I think I know the answer, but I want to make sure I can confirm. And the question was, does it apply to people that live with them? And it does not. It applies to the people that were employed by LM Wind Power. So the actual quarantine order that has the effect of the state health officer is for the employees. We are, of course, asking, if, as we've had all along, if you are living with someone who's positive, presumed positive, waiting for a test result, we would ask that those people also follow the guidelines as well. But the quarantine order specifically only goes to the employees.
Do you think that fact will limit the effectiveness of the order?
Yeah, compliance, if you have low compliance, it limits the effectiveness. But in this case, we felt, again, we're trying to have the right touch of applying available law with appealing to individual responsibility. We know that the GE LM has also asked their employees voluntarily to stay home as well. So we think that between their employer who's paying them and the state quarantine order, plus the appeal to social and responsibility and individual responsibility, will hopefully for everyone in the Grand Forks area get good compliance on this. We do know that of course some people that may be hearing right now at this press conference that they've been quarantined. So we know that may come in addition to the, hey, our plant's closed, but you're going to get paid, and we'd like you to stay home. Now we put the quarantine on top of that. This is something we've talked about with the mayor, but there's a number of services in Grand Forks that are available that they're going to coordinate with LM. If people need to have food brought to them, medical supplies to support people during their quarantine, because not everyone that works there may have a full network to support them. And so again, to avoid everybody having to rush out to get 2 weeks of supplies right now. Again, we want people to know that there is support systems in place to help support people in quarantine. We'll go to online and then Lane.
Adam Kurtz with the Grand Forks Herald. Can you explain the difference between self-isolation and quarantine, and how is a quarantine order enforced?
Mylyn, do you want to come up and take that one? And you got the question?
I do.
Okay.
So the question about what's the difference between isolation, self-isolation, and quarantine. On self-isolation, those are for individuals that have been symptomatic or tested positive. And the goal with self-isolation is to separate yourself from the other contacts that you might expose yourself to in your household. If there's a way that you could isolate from them, that would be very important. On quarantine is that you haven't tested positive yet, but you have come into contact with someone that we know that has tested positive, and we want you to stay at home for 14 days because you could still develop COVID-19 within that full 14-day period.
And then how is the quarantine order enforced, and specifically how will the LM order be enforced?
So quarantine order is enforced at the local level, and for LM, this would apply for them as well. And the employer has done everything is helping to support that.
Lane?
Governor, I might have missed this, but did you, are all the employees that work there at LM being tested, and is that all being done at one time, or are we spreading that out?
The testing that was done on this past week did not cover all 900 employees. I think there was 425 tests that were taken, and that was a combination of three things. It was a combination of people that were in close contact with the ones that had previously tested positive. It was other close contacts of people that may have been household members or others that weren't employees but were invited to come and go through the drive-through testing. And then there was also a randomized surveillance test of some people that were not known to be in close contact with the original positives, but just to try to get a sense of some asymptomatic testing of people that weren't there. We do intend, and General Dorman's here to talk about it if we need to get into more detail, but we would likely get back up into Grand Forks with another drive-through testing effort sometime this next week. As Mylyn just indicated, the incubation can occur over a period of time, and if we rushed up and tested another 500 people that were asymptomatic today, we may not get very many positives, because if you may have it, but if you don't have enough viral load, if your symptoms haven't developed, if the virus hasn't developed in your body, you may not show up. So we may be more productive at identifying positives early next week, and so that's in work. But Dr. Weiser is on the phone from Altru. We also have indicated they have enough testing supplies right now. They've had drive-through testing going 7 days a week at Altru. If people, are symptomatic today or have concerns or feel like they've been in close contact, they should call the Altru hotline and go through a phone screening with them and then determine whether or not they should be tested. But Altru has enough test kits to keep testing through this weekend, and we're in the process of getting more test kits to them in addition to the possibility of doing another rapid response large-scale testing effort up there early next week. So yeah, testing is going to continue. Jeremy?
Follow-up to that, is there an exception to this order for workers who would like to get tested?
I'm sorry, to understand that, an exception how?
Can they leave their homes to get tested?
Yes, of course. You can, if you are, and I'm sure there's a way that we handle that. Mylin's nodding yes, but there would be for medical conditions. I mean, if someone's getting sicker and you're either self-isolating at home, you call your provider and go get additional care. I mean, we're not excluding people getting medical care through any of these orders.
I also have a question for Dr. Weiser, if he's still on
Okay,
the
Dr.
phone.
Weiser, a question from you from Jeremy Turley from Forum News Service, if you're still on the line.
Doctor, if this reaches the level of the outbreak at the Smithfield plant in Sioux Falls, does Grand Forks have the medical infrastructure? Does the healthcare system have the bandwidth to withstand that kind of outbreak?
Yes, as I stated in my opening remarks, based on the projections so far on the percentages that we're looking at, we do, and we have a tiered approach to address that, and based on how we shift our staffing. From my understanding, there was a total of 65 that became hospitalized out of that outbreak, which is a good number considering the number of people affected. So we have to remember that a lot of people recover this with minimal to no symptoms, and that's above the 80% range, and only about 5% or so truly get critically ill. So,
Thank you.
And for clarity for the viewers, the 65 hospitalizations that the doctor was talking to related to the South Dakota meatpacking plant ratios. And again, Jeremy, on your question, do we have enough capacity? The other reason why we built the state surge plan is that if one community like Grand Forks got overwhelmed, there's been a long history in I would say regular times. Dr. Weiser described that to me earlier today, but if they needed assistance from hospitals, say in the Fargo area, then they've had the ability to transport patients down there. And so we have a lot of capacity in the eastern part of the state. And so Altru's got enough, we should be in good shape, but before we would even get into some of the other tiered plans we talked about, the simplest thing would be just transfer patients to 1 hour away to where we've got a lot of capacity. We'll go back online.
Dave Kolpak with the Associated Press in Fargo. Due to LM's designation by Homeland Security as a critical manufacturing business, does that mean they could not have been shut down even if you had wanted to?
I think, Dave, you're asking a legal question, which I've not explored the answer to. But I can tell you by intention, we never had any desire to shut down, critical infrastructure in North Dakota, regardless of what the feds may or may not have said. But clearly, they were designated as part of that federal designation by Homeland Security. But it was a legal question that we never addressed. But I guess I could look it up. But again, we're trying to get things back open. We're not trying to close more things down. And the way we get more things open is targeted testing, self-isolation, quarantine, and great contact tracing. Well, that's the game plan to get open, and that's all happening with this LM situation. Jacob, we'll go back online.
Governor, when we first started holding these daily briefings, you said if you are early, you're on time. If you're on time, you're late. Doesn't the concept of doing targeted testing after an outbreak is identified an indication that you're not being early?
No, it's not. I think what would be discussed to do testing before an outbreak would be called surveillance testing, and very little of that has happened in our entire country because as testing supplies ramped up. I mean, the closest thing that's happened to anywhere in any of the states around us would be what we did in Slope County, where we went in to do a large amount of testing in a county that had, at the time we planned to do it, had no positives. And so that was that kind of surveillance testing. That kind of surveillance testing, or as Dr. Birx calls it, sentinel testing, which is like a sentinel that's out there on front in a military terms. It's an early line of defense, that's sort of on guard. And we would hope as we go forward in the weeks and months ahead that we could be doing sentinel or surveillance testing more broadly across the whole state, where you might be doing a sampling of testing in every county every week. Even with people that are asymptomatic, to just try to you would find it before they even know it's here, before people even know they have it, you get some alert. But the best practice, what we're talking about now, which we've done like we did in Montreal and now we're doing in Grand Forks County, is when you have a group of positives like we had those 8, if we hadn't gone up and said we're going to do 425 tests of people that were known or whatever, we wouldn't have come up with the big numbers we came up with today. So this is exactly what we want to do. We're hunting for positives so we can identify them. In some cases, you're identifying before they've even become ill, and then you have the self-isolation or quarantine the orders that go in, and that helps slow the spread in a targeted way versus us having to, more broadly ask everybody to be in compliance about staying home. So I'd say strategy's working, and this is, like I said, this is happening now. Could be happening 3 months from now, 6 months from now, and we'll have the skill to do it. As I said the other day, we have to have the ability right now to be able to do this in multiple communities at the same time. We're fortunate these are kind of coming up one day at a time, but we want to have that rapid response testing and contact tracing capability to do these around the state simultaneously.
April Baumgarten with the Forum of Fargo-Moorhead. Are there any plans to do testing in other factories or food processing plants in North Dakota that have large numbers of employees? And is the state doing inspections to make sure these large employers are following guidelines?
2 questions. The first one, it's certainly part of a longer-term plan that we would be trying to do more testing when we've got large populations working in these kinds of facilities. As is the case, however, if you've got a population that is generally working in a manufacturing setting, might generally be younger and healthier, say, for example, versus where we've got in congregate living. And as testing supplies come available, healthcare workers, first responders, people that are coming in contact with COVID, and particularly the people that are entering our long-term care facilities, the people that are going to work there every day, we would direct resources likely to those more vulnerable populations before we would just go out and start testing all manufacturing plants. But as I've said before, if there was there will come a time when there is such low-cost, broad-based testing that employers themselves might be doing this testing because no employer wants to have an outbreak. I mean, the most valuable thing for any employer is their team members in this environment, and that's absolutely true when you're in an environment which we will likely return to, where you've got a period we've gone through a period where you have more people, more jobs available than people looking for jobs. Workforce protection is one of the important skills of any successful company, and that testing of your team members and workforce safety might have used to mean slip and fall, and it's also now going to mean workforce safety in terms of protecting against contagion as part of those practices that you'll see. And I think we'll see that at workforce safety conferences. We'll see it all over. There's going to be a bigger component of that going forward. And I think April had a second question, was who's enforcing, who might do, or who would do inspections. And right now, again, inspections related to health fall on local public health officers, and they are, severely strained, as is any health organization in our country right now, because of the immense workload that's going on. And so right now we'd be looking to business groups, employers, and others, because again, there's a lot of economic incentive for any manufacturer to make sure that they're doing all the very best practices in terms of keeping their employees safe and healthy. So I'm not overly concerned about compliance at those right now because of the strong economic incentive they have to comply. Dave?
Governor, I think I heard you say that 20 people were working on contact tracing out of this LM thing?
Yeah, a lot of the Grand Forks, led by Debbie Swanson out of the Grand Forks Public Health Group, but she's got her team. We've brought in some more from other health areas around the state that currently weren't, that had some capacity. And when I say brought in, not necessarily physically there, but they're, given a list of names and they're doing the phone interviews because contact tracing is largely phone interviews. We've also pulled in nursing students from UND Public Health and NDSU Public Health. There's, great programs there in public health, Masters of Public Health programs. Some of those have already had training, and that's where we get up to this 20 number. But as we talked on the phone earlier today, we'll bring in even more resources, particularly if we go back next week and we do another wave of testing up there of this same kind of scale. We may need to bring even more resources to bear.
Then you think there's going to be more ramping up of contact tracing?
Well, statewide, absolutely. I mean, this is one of our priorities. We've talked about that we've got to go from we were at tens, we might be in hundreds, but in my mind, I feel like we've got to have units all over the state, and maybe it's 1,000 people by the time we get done that are working on this, because you'd want to have them to be able deploy locally. You'd want to be able to have them deploy within. I would envision that you'd have that capability within the sovereign 5 nations that we have, that we share geography with. So I think it's a big, large-scale capability that is going to have to exist until such time that there's a vaccine. You can ask one more and then back to online.
Was there any way that this outbreak could have been prevented, referring to the outbreak at LM?
I don't think so. In terms of because again, we have a highly contagious disease that is spread very easily, and we know that even in places where we've got great precaution, like a nursing home where we've restricted visitors for 5 weeks, where they're practicing hygiene within there. We know we've had outbreaks in every state in the country in places where we're desperately trying to keep it out. Now in manufacturing places where you've got 900 people coming and going every day, who've also got, families and they're shopping and groceries and all that stuff. The number of potential transmissible moments gets to be, you multiply people times potential other people they see times places they've been, it would be really, really challenging to sort of say, hey, we're gonna prevent that. Okay.
Steve Hallstrom, WZFG Radio in Fargo. We've had reports that some hotels are being prepped to act as the temporary homeless shelters you had mentioned. How are these hotels handling individuals so that other guests can feel confident that they are safe from the virus? And will these individuals be monitored to make sure they're complying with any quarantine orders and in line with self-isolation?
The last part of that is, yes, they will be monitored and supported. And again, this program that's running through Department of Human Services is, hotels that volunteered to be part of a sheltering program did so on a voluntary basis. We do know that one of the other things when you reduce travel, whether it's air travel, road travel, and all the travel restrictions, that one of the sectors that has had a big drop off in occupancy is the hotel sector, and some hotels have closed voluntarily. Others or just due to lack of business. Others have remained open, and some are seeing this as a way where they can participate as a community member, support the community, and help serve those in need. And all the safeguards have been put in place to make sure that they can create that separation in these cases. So Department of Human Services and the local shelters, I think, doing a great job. We're talking about, I would say, what do we say, there's 12 people currently in the program. I don't know right off the top of my head how many hotel rooms there are in the state. I know there's more than 5,000 just in the Fargo area alone. And so we're talking about, one teeny 0.2% if they're all in Fargo, but the 12 rooms are spread around the state. So this is this would clearly be considered a rounding error in terms of occupancy, but it's really welcomed that these organizations are stepping up, acting as community members and supporting those people in need. One more online, and this is the last one.
Sydney Mook with the Grand Forks Herald. Do we know if the LM cases were contained to a certain part of the plant?
We don't know that, and based on the fact that we have a 110 positives so far with more tests coming, and I think it's safe to assume that it was widespread within the plant, and that's why, again, GELM has responsibly shut down the entire plant and is cleaning the whole plant. With that, I'll just say gratitude for particularly thanks to the media that rallied over here on a Saturday afternoon, on a beautiful Saturday afternoon, and for the North Dakotans that are watching. Hope you're getting a chance to get a breath of fresh air with a dose of individual responsibility. As I was coming here for the press conference today, there was a group of people that were at least 10 feet apart from each other holding an exercise class on the steps of the Capitol. Not something I'd seen before. One of them was wearing a pink tutu. So anyway, people are having a lot of fun out there doing some pretty aggressive step work on the Capitol steps out in front. So enjoy the fresh air, get exercise, stay healthy, and keep being North Dakota smart. And again, thank you, Mayor Brown. Thank you, Dr. Weiser. And thanks to all the people in local public health, the National Guard, and others that acted so quickly to allow us to get up and start containing this situation that occurred in Grand Forks County. So thank you all, and we'll see you Monday at 3:30, assuming we don't have another breaking news story tomorrow. But hopefully we'll have that. We'll see you on Monday at 3:30. Thank you. Stay healthy, North Dakota.